Hello and welcome to Medical Dialogues. I'm Mr. Zaman and let's look at today's top headlines. Despite zero cutoff percentile for NEET-PG, 484 non-clinical seats lying vacant in Karnataka. Despite the National Eligibility Cum Entrance Test Postgraduate or NEET-PG examination having a zero cutoff percentile, many non-clinical postgraduate medical seats in Karnataka remain unfilled. Several medical colleges in the state have offered these seats for free, but there is limited interest in these courses. In contrast, all the clinical category seats have been occupied. The NEET-PG counselling concluded on October 25th, and according to data from the Karnataka Examinations Authority or KEA, 484 non-clinical seats went unfilled. This includes 90 seats in anatomy, 88 in microbiology, 86 in biochemistry, and even seats in non-clinical subjects like pharmacology remained vacant. The executive director of KEA, Ramya S., explained that despite their efforts to persuade students to consider these non-clinical subjects, many students chose to surrender the seats. However, she noted that more seats were filled this year compared to the previous year, partly due to several colleges offering these seats for free and the zero minimum percentile requirement. Aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code or access the link in the description box below. Quarantine period during COVID-19 duty part of medical students' bond service, Madras High Court says. The Madras High Court has ruled that the quarantine period for postgraduate medical students serving on COVID duty should be considered as part of their 2-year compulsory government service. In response to a writ petition filed by Pradeep Vasudevan, a postgraduate student in general medicine served at a primary health center in Salem, Justice Anita Sumant allowed the inclusion of his 150-day quarantine period in the bond requirement. She stated that the quarantine time was essentially an extension of the student's COVID duty. The court ordered the state government to reduce the petitioner's in-bond service period by 150 days, moving the end of the bond period to January 2, 2024 instead of May 31, 2024. The petitioner completed his postgraduate studies in May 2022 and had signed a ₹40 lakh bond committing to 2 years of service in state institutions. However, the onset of the pandemic led to medical students being called upon to assist in government hospitals, including those associated with their colleges. Private Delhi hospital doctors directed to pay compensation for failing to provide appendix treatment to minor patient despite diagnosis. The Delhi State Consumer Disputes Redressal Commission has ordered a private Delhi hospital and its doctors to pay a compensation of ₹250,000 to the father of a minor patient for their negligence in administering appropriate treatment for the patient's appendix condition. Additionally, the hospital has been directed to refund the entire amount of ₹641,000 charged for the patient's treatment at Sir Gangaram Hospital. The case involved a minor patient who was admitted to the hospital in 2018 with severe abdominal pain, vomiting and fever, which was diagnosed as an appendix issue. Despite the diagnosis, the hospital allegedly failed to provide the necessary treatment. The patient's condition deteriorated and she was discharged without proper appendix treatment. Later, the patient was transferred to Sir Gangaram Hospital where she underwent surgery for drainage of a pelvic abscess and appendix removal. The complainant alleged negligence on the part of the hospital and the treating doctors, leading to prolonged suffering. The hospital and doctors did not contest the claims and the complainant provided evidence to support their case. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.